Our breast is not acted upon because we don't have the female hormones. In some situations, some female hormone, if there is a variation in the hormonal balance in our body, that can act on it, and the same breast gland can develop. So it can be because of two reasons. One is fat alone, or breast gland, or a mixture of the two.
Hello sir, how are you?
Good morning. How can I help you?
Sir, I have some queries regarding gynecomastia.
Okay.
So how common is this?
Sir, gynecomastia in common parlance is called man boobs. It is a fairly common issue. In the last few decades, it's become more common because our nutrition has improved. People are becoming a little more obese. So amongst the teenagers, amongst the young adults, it's quite a common problem, and they seem to be worried about it.
And sir, why does it happen?
So there are two aspects to gynecomastia. One is obesity, if somebody is overall a little on the plump side, or like a female breast, we also have a breast. Our breast is not acted upon because we don't have the female hormones. In some situations, some female hormone, if there is a variation in the hormonal balance in our body, that can act on it, and the same breast gland can develop. So it can be because of two reasons. One is fat alone, or breast gland, or a mixture of the two.
And sir, what are the options for treatment for gynecomastia?
So there are many options, but none of them work. You see, the best one option is if you're obese, you reduce weight. Unfortunately, even if you reduce 10 kgs of weight, this weight doesn't go off from here. So you have many medicines, many people that advocate medicines. My experience of the last 45 years, none of them work. There's only one thing which works, is we physically remove that tissue. That tissue, which could be fatty tissue, which could be gland tissue, we remove it, and once we remove it, it stays removed forever.
And sir, how to prepare for the surgery if we plan for this?
So you understand that we are doing this surgery for just one reason, and that one reason is for you to feel good about yourself, for you to wear a t-shirt which you want to wear, for you to go to a swimming pool the way you want to go. Once you're clear that this is what you're going for, then leave the rest to me. The rest to me would be, I'll do some basic blood tests to see that you're safe for anesthesia. Then you come in for surgery. It just takes an hour and a half, and that's it.
And sir, what should I expect?
So you expect that you come into my hospital in the morning. We will request you to come in empty stomach if you want to choose to have it under anesthesia. We will take you into the OT. You will be anesthetized. When you wake up an hour and a half later, you'll be free of pain. You will be having a bandage on your face. You will be discharged 2 to 3 hours later. You can sleep as normally as you want. You can eat, drink, active, everything yourself. You can look after yourself. And actually, in 3 days' time, if you don't have a very strenuous profession, you can go back to work.
And sir, what about the post-op recovery after the surgery? How much is the recovery time, downtime?
So, you will be having some bandage on you. We typically change the bandage on the 3rd day. We change it, and then we ask you to wear a tight vest. Now, if you've seen some footballers playing the tight vest with a similar vest which goes under your clothes. So nobody knows that you're wearing a tight vest. And that's it. Even our sutures, we do have stitches. Most of the times we put in absorbable stitches, so you don't really need to do. The only one restriction we have for you, that is not to do upper body exercises for 2 to 3 weeks. If you do understand, We are going to pick up the skin and remove the tissue underneath, and there's muscle there. So we don't want your muscle to move too much. For us, just as a matter of precaution.
And so, will there be any scar after the surgery?
So all surgeries have a scar, all. But when you come to a plastic surgeon, we camouflage your scar very well. Our scar is between the dark area around the nipple and the normal skin. So that scar is pretty much invisible. I mean, you can go to the swimming pool and nobody will notice it.
And so, being a right candidate, what else would you like me to know about gynecomastia?
So whenever you choose a surgery on your body, it's an invasion on your body. So you have to choose a doctor where you are comfortable with, a doctor who has done this many times before, and the hospital. Hospital should be having good processes. You know, in our country, we have accreditation units like NABH, JCI. A hospital which has NABH accredited will have good processes in place. And when there are good processes, you expect good results.
Thank you so much, sir, for letting me know.
Thank you.
For that.
Whenever you make up your mind and you have any other questions, you're free to come back.
Thank you, sir. I will do that.